build on Malcolm's comments around collaboration in terms of how philanthropy is impacted by that. And really, I guess the key message I want to leave with you as a group is the collaboration and the integration that's been going on within our hospital system locally for the last 10 years, 15 years, has a direct impact on philanthropy as well. And so while we are 3 hospitals, and I like to note that I'm also here on behalf of my colleagues in the foundations at Cambridge and Grand River, while we are 3 separate entities in terms of raising money for our respective hospitals, we are in fact looking for investments for the entire hospital system in this community. And one of the benefits of clinical integration and the fact that, the case of St. Mary's and Grand River, with the exception of emergency medicine, perhaps a little bit of general medicine, there are very few things that we do where we're duplicating resources. So what that also provides the opportunity is we're not also competing to raise funds in this community, scarce resources like in any sector, for essentially the same service at a hospital 4 miles, hospitals 4 kilometers apart. And I think what that has the benefit is it allows the business community and our donors to be able to really laser in on where they want to have a direct impact. So when I think about, when people say, what is it that you need? The response really is the hospitals don't really have any needs. I remember the first time I almost made Moira Taylor faint is when I was in a room full of people like this, and somebody asked me, what do you need money for? And I said, we don't really need any money. She looked at me, and I said, because the reality is it's not the hospital that has the needs. And I think that's where we have to continue to move the conversation around investing in the healthcare system. It's not the hospitals. We don't sit around and dream up big pieces of equipment, big buildings that we need to have or feel that are great. It's the community, it's the growing community, it's the expanding community, the changing community that has the needs. Our job is just to fill those needs. So when Cambridge Memorial Hospital is raising funds for a new MRI, it's the community that benefits. When Grand River is raising funds for a new renal center or a new neonatal unit, it's the entire community that benefits. Or in the case of St. Mary's, as we launch a campaign to bring cardiac arrhythmia to this community, it's exactly for that reason. It's not for St. Mary's, it's not just for a select group of people. Well, it is for a select group of people, but it's for the community. And so sometimes, Ian asked me to talk about, sometimes we do this together and we collaborate. The foundation's a good example is Jeans and Scrubs fundraiser. I know some of you were there. So wherever possible, we like to collaborate. We often get asked by foundations and corporate sponsors to come together and provide joint proposals. I can think of, probably the most notable is the Hallman Foundation. Every 2 or 3 years, the Hallman Foundation does a specific call. They ask all 3 hospitals to come together and they say, what are the clinical priorities that you have? And they fund us together, and we propose those together. But ultimately, the thing to remember is the results are what we're trying to achieve, and it's not about dollars raised. And I can tell you in this community last year, mentions the amount of money that was raised at St. Mary's. Collectively, we probably raised about $15 million in this community. But the number is really not important. What we're trying to really focus on is where's the impact? And I think as your hospital foundations and your hospital CEOs and everybody that works in this system, our responsibility to you is to do what Malcolm just did. Is to report back to you and tell you, here's the impact of what you have done. And when I think about Al and his comments around general practitioner and specialist recruitment, I can tell you without a shadow of a doubt, the work you have done has made this community a better place. There's a cardiac physician that's come to our hospital just in the last couple of years. He's Canadian, expat. We recruited from the United States. And I was talking to him about why he chose here. This physician could have gone anywhere. And he said, well, clearly the community supports the hospitals. I see the technology in the hospital. I see the referral patterns. I see what the investments that are being made in primary medicine. No, of course it's not perfect. But the reason that physician chose to come here is because he saw the community support. And so it has a direct correlation. It's actually cyclical. And so the amount of time and energy you put into your health system attracts economic development, it attracts new companies, it attracts new talent, and it attracts the physicians and other healthcare workers that make it go over. And we become an attractive place to be. So I applaud the Chamber for its efforts, not only on primary care physician recruitment, but on the specialist recruitment, because I'll tell you, it's those folks that then recruit others. And we build that. And so Malcolm talked about the fact that we're not even looking for an emergency room physician. And it was only a few years ago where we had days where we weren't sure who was going to work a certain shift. I can tell you at St. Mary's Hospital, we have 14 to 15 cardiologists, specialized cardiologists who do lots of different things, including surgery, who 12 years ago, when Bruce Antonello was key in bringing these folks to this community, we had none of these people in this community. They came because we were building a cardiac center, a regional cardiac center. We built a regional cardiac center at St. Mary's because of you. So all those investments, it's not about the technology, it's about the impact